The Ebola crisis, I guess, raises the question, what is global about global health governance? With regard to pandemic preparedness, it seems that a lot of emphasis has been placed and a lot of effort has been put into building global capacities to gather information and intelligence about disease outbreaks. But a lot less emphasis has been placed on building a global capacity to respond. And I think that will be the challenge in the future and the lesson to be learned, hopefully, from the Ebola outbreak.
I don't think the Ebola crisis tells us very much about the state of global health governance generally. I think a lot goes on in the world in terms of ensuring that people enjoy health opportunities, ensuring that people are avoiding various disease risks of all kinds. This is an exceptional case. Thousands have been infected with Ebola virus and a smaller number of thousands have died, and the virus has for the most part been contained within a small area of West Africa. Now, it is a local health crisis, but it has to be said that there are global dimensions. It is of global interest to people beyond West Africa, because this virus on this particular occasion appears to be transmitting more efficiently and further afield than ever before. And we've known about Ebola virus for nearly 40 years. It's behaving differently this time. And it interests people around the world that this virus could somehow hop on a human being who then hops on a plane, arrives in a country outside of West Africa, becomes symptomatic and then spreads the disease to other people. So it's actually a highly unlikely scenario, and now that the rest of the world is alive to the existence of Ebola as a health threat, it's very unlikely that an Ebola case in a non-West African country would not very quickly and efficiently be contained.
The escalation of the Ebola outbreak is linked to the inadequacy of global health governance. And despite the fact that it's long been recognised that we need to address the structural determinants of health, these have effectively been invisibilised. Complex emergencies such as the Ebola outbreak are rooted in much longer processes than the outbreak would actually suggest. Even when Ebola is contained, unless these underlying structures are effectively addressed, then they will lead to future crises and other health emergencies.
I think probably the clearest message is that we have a long way to go. Ebola has really brought out several inadequacies and highlighted some of the problems that we've got with low-income countries and middle-income countries, and how investment in healthcare systems has really not been to the level that we need, I guess, to respond to these types of events and crises. And it's highlighted the inequalities, it's highlighted the inability for the international community, and particularly some of our key institutions, to respond rapidly to unfolding humanitarian crises, which is certainly one of the things that Ebola is. Implicit within the whole concept of global health governance is this idea of good governance and order and structure. But what this outbreak has really demonstrated is that not all governance necessarily is good, and there are inherent weaknesses within our existing institutions. There's likely to be a large focus on the World Health Organization in the months and weeks ahead in terms of its approach to this. And while the organisation may have been right in how it was responding to the epidemiology of this outbreak, it really sort of appears to have failed the political test in raising the balloon and highlighting the unfolding nature of this emergency. And so we can expect that its member states will likely be calling for further action, further reforms in the weeks and months ahead.
I think actually one of the key things it tells us about global health governance is that in whatever configuration it is at the moment, it's not quite working. There's been a lot of actors, a lot of a framework of multiple actors involved in the response, and the way they're working together isn't fit for purpose, because this Ebola outbreak could have been halted, like previous outbreaks of Ebola, a lot sooner. I would suggest that one of the reasons this has been is because there's been a sense of global shared responsibility to combat the outbreak. And actually the problem with that is that no one is accountable for a global responsibility. You need to have, although you can blame individuals for certain things, and you can hold the WHO responsible for not acting soon enough, or the pharmaceutical company for not producing vaccines, prior to this outbreak. The problem is, if it's a global responsibility, who is actually accountable at the end? And that's where the flaw, I would suggest, of the global health governance system at the moment is.
The Ebola outbreak in West Africa, I think, has revealed three limits about global health governance. The first is that there clearly is a need to strengthen local health systems. They are very much the front line when a new disease outbreak happens, and so we have a collective interest in making sure we strengthen these systems around the world. The second limit I think it exposed is that it wasn't quite clear who actually had institutional responsibility to respond to this outbreak and make sure it doesn't spread more widely. So I think the second thing we need to do is we need to really clarify who has responsibility for being the first responder to these kinds of outbreaks and making sure that they also have the capacity to respond quickly. The last thing I think that the Ebola outbreak really showed was that diseases can rapidly change in the way they spread. And that we need to think, therefore, more creatively about how we can develop medicines and vaccines so that we are better prepared when future disease outbreaks happen.
The Ebola crisis in West Africa tells us three key things about the current state of contemporary global health governance. The first is an end to globality in global health governance. We see that the response has been primarily bilateral, so that's key states going into specific countries of the Ebola 3. So for example, the UK going into Sierra Leone, Liberia being catered for by the United States. And that's really an end to this kind of multilateral response to global health that we've seen before. So for me, it's an end to global health and a retrenchment more towards international health. The second thing it tells us is that the real leading institution in global health governance, the World Health Organization, is an institution in crisis. The World Health Organization was an institution in crisis before and has been undergoing a period of reform in response to internal and external criticisms of what it's done. And Ebola has really brought into stark light some of these kind of tensions. And I think while the WHO has been on the ball in terms of the epidemiology of what's happening with Ebola, it's really missed the political zeitgeist of framing the debate over this issue, which in turn is hollowing out the institution itself. The third thing it shows us is how women underpin global health governance and the gendered structures of care. So we see from reports by UN Women that the majority of people dying from Ebola have been women. And this is because women are at the first front of responding to the epidemic. They're caring for people who are sick, they're caring for neighbours, people in their communities. And this really shows that quite a lot of global health policy, as lots of feminist researchers have shown, is that it depends on the free labour of women.
Well, let's face it, it is very likely that in the coming weeks Ebola will recede back into invisibility. And I think that what it tells us about global health governance is that it tells us a lot about the reproduction of neglect in global health governance. I think that Ebola will continue to be a neglected issue in that the social and economic conditions that have made this outbreak possible have not been addressed by present initiatives. The West and the developed world have considered Ebola, or have approached Ebola in this case, as a kind of a political spectacle and not as a problem of human health insecurity. So in that sense, we can also argue that throughout this process, Ebola has continued to be a neglected issue, has never stopped being a neglected issue. So it tells us a lot about the production and the reproduction of neglect in global health governance. It tells us the reactions to Ebola tells us a lot about the West and its anxieties and the way it is actually global health problems and crises are being addressed in today's governance.
The Ebola crisis really highlights the nature of fragile health systems in the affected areas. But another thing it also highlights is the intense public interest in this case around the world. And so we've seen a lot of funding going into it. We've also seen a lot of public support in terms of charity giving. And what's really interesting in this case is thinking about the ways in which this public interest has mirrored and has also, I guess, highlighted problems in the more political governance structures. So, for example, we see cases such as the criticism of the WHO for not acting fast enough, and the way in which this causes tensions with the public understanding of governance mechanisms. So what Ebola really highlights is the way in which moral ideals about public health and the need to help these nations can reflect badly on existing political structures surrounding global governance, and the way in which, although global governance ideally is able to react to these problems, there are different types of mechanisms that slow down or impede the way in which help can reach these areas. So I think it's a really good test case for trying to understand some of the strengths in global governance, for example, in surveillance and seeing new cases, but also some of the weaknesses in terms of responding in a really effective manner and in a manner that's also really sensitive to the cultural considerations and political considerations of particular contexts.
So I have to start with a caveat. I am speaking in my personal capacity, so I don't represent the views of the British military, the British government, Ministry of Defence, or the Royal Military Academy Sandhurst. But in terms of what does the Ebola crisis tell us about the state of global health governance, I think it perhaps shows that global health governance may not be adequately structured to deal with crises like the Ebola crisis. But that doesn't mean that we should necessarily see a whole-scale revamp or renewal of global health governance. I think that might be too big a reaction. We maybe need to exercise a little bit of caution. What is interesting is that where we've seen this inadequacy of response, or where the global health governance response has faltered, states have fallen back on much more traditional methods of response. So we've seen bilateral relationships reflecting old historical ties, or a recourse to more traditional methods of response when Ebola is labelled a security crisis. We've seen militaries deployed in response to it.
Well, I think it's really interesting that we make the assumption that the Ebola crisis has anything deeper or broader to tell us about global health governance, and particularly that it highlights the failing of global health governance. I mean, I think that needs us to ask a prior question, which is, what is global health governance for? Do we want global health governance to be a system to deal with these exceptional crises like Ebola? Or do we want it to be a system which addresses on a more day-to-day basis the kind of vulnerabilities which most people in the world face most of the time? So I think one of the dangers of trying to reform a system of global health governance in light of the experience of Ebola is actually that it may lead us to only focus on those certain exceptional events, and that might not be a very sound basis for reforming global health governance. So certainly I would think that global health governance is failing to deliver what we want it to deliver as a system, but for me it wouldn't be Ebola which proves that, it would be something like deaths from infant diarrhea which proves that. I think that's really the challenge for global health governance.
I think there's an assumption there that there is something called global health governance. And I think that the Ebola crisis allows us to look at global health governance critically rather than see it as something that needs to be done better. And I think there are obvious reasons why that's the case. I think the Ebola crisis identifies a whole range of different actors that seem to be operating in an uncoordinated, self-interested way. And if an alien were to look at the Ebola crisis from above, they may not use the concept of global health governance as a useful concept for explaining how the world works. I think Ebola arguably masks some of the really important issues that aren't being looked at the moment in development. So power relations, self-interest, and some of the structural drivers that oppress and restrict the way that a proper functioning human world should operate.